Hi everyone. Today I'm going to discuss about infertility. So what is infertility? Infertility is a disease of reproductive system, male or female. So it is a failure to achieve a clinical pregnancy. Let's see what we are going to say. Today I'm going to say about definition, incidences and factors affecting fertility. So today we are going to discuss about only female factors. And next session, we are going to discuss about male factors and also how to prevent this infertility and what will be the management. So let's see the definition. Definition is inability to conceive after 1 year with approximately timed coitus without usage of contraception. So many people does not know what is timed coitus. Coitus, that means sexually intercourse. Sexual intercourse. Timed means during ovulation. So everyone must know that during ovulation, if they have sexual intercourse, there are high chances of pregnancy. So what is infertility? When they do not conceive after successful 1 year timed coitus. If they don't conceive, so that is termed as infertility. So इनेबिलिटी टू कंसीव यानी कि एक साल के अंदर टाइम्ड कॉइटस सेक्सुअल इंटरकोर्स करने के बाद में भी ड्यूरिंग ओवुलेशन अगरचे प्रेगनेंसी नहीं हुआ है उसको इनफर्टिलिटी कहते हैं. लेट्स सी द इncidences. So incidences, it affects almost 15% of couple with the risk increasing for women after 35 years of age. Remember, infertility can occur to men and women. So many of people will think till now that infertility will occur to only women. No. So it can happen to anyone. So high risk people are women are 35 above 35 years of age. So we'll see today only female factor, male factors we'll see in the next session. So what are all factors affecting in fertility? So female factors we are going to see. First, problems of ovulation. So what is this problems of ovulation? The first one is hypogonadism. Hypogonadism, that means when there are less sex hormones or no sex hormones produced by the ovaries or testes. So there are gonads. What are all the gonads? There is a female gonads, male gonads. So what is female gonads? Female gonads are ovaries. Male gonads are testes. So when these will not produce sex hormone, sufficient sex hormone or no sex hormone, then it may be causing hypogonadism and finally infertility. Next is the radiation. See, radiation exposure definitely cause infertility, and chemotherapy, high usage of chemotherapy also will be causing infertility, and long usage of oral contraceptives. So oral contraceptive, if they use, there are many medicines available in the market. So without uh, knowledge, people are consuming contraceptive. So that definitely affect infertility. So better to go with the copper T or intrauterine devices to use as contraceptives. So here oral contraceptive should be avoided. So use of long oral contraceptives may affect fertility. Next, hormonal abnormalities. So in the female, hormonal abnormalities, irregularities in hypothalamic pituitary ovarian axis. So what is this hypothalamus pituitary ovarian axis? So यहाँ पर that means complex interaction between hypothalamus or pituitary gland and ovarian that regulates the reproductive cycle. If there is any complex interaction, so this will affect fertility. Next is the poor general health condition. So poor general condition like inability to perform physically, mentally, socially activities, and also low immunity. So this may also affect fertility. Inadequate nutrition. So inadequate nutrition like protein, energy, malnutrition, not taking sufficient diet. So this also affect fertility. And next is the stress and excessive exercises. So stress always causes many problems, health problems, physical or mental. And excessive exercises also affect fertility. So obstruction or narrowing of fallopian tube. So here you can see this is the fallopian tube, and from ovaries the ovum has to travel through fallopian tube to the ampulla of the tube. So ovum has to travel from fallopian tube and the sperm has to travel through vagina and the fertilization will occur here. So when there is a blockage or obstruction, narrowing, the ovum cannot travel to the ampulla of the tube. So this also may cause infertility. Next is the scarring. Scarring can result from organisms such as Neisseria gonorrhea, Chlamydia, Trachomatis, Mycoplasma, and Mycobacterium. So these also may cause infertility, these infections. Structural problems. So structural problems like fibroids. So these are called as fibroids, which are the tissues. You can see fibrous tissues here over the uterus, and this typically developed in the walls of uterus. So these also may cause infertility. And next is the tumors and inadequate endometrium, यानी कि thinning of endometrium. So this due to inadequate hormone production. So that is inadequate endometrium. Next is endometriosis. Endometriosis yani ke the endometrium grows out of the uterus. So that is called as endometrium. Let's see the what is bicarnate septate and structural problems of the uterus. Here, this is normal uterus, you can see, and this is bicarnate uterus, and this is septus. Here, you know the parts of the uterus. This is fundus, this is fallopian tube, ovaries, and this is vagina, cervix, and body of the uterus. These are finger-like projection called fimbriae. So, uh, this is the structure of normal uterus. Here you can see bicornuate uterus where the fundus has been divided into two with the cavity involving. And this is a congenital anomaly through birth and septate and complete uterus where fundus will be the same and cavity has been divided completely to the two parts. So these also may cause infertility in the females.